Hi guys, this is Jason Williams DO. This is the Williams Family Medicine channel, helping you to live your best life. Today I wanted to talk about obesity and weight loss. Of course, these things are hot topics and are commonly brought up in my clinic. Everyone wants to know the secret for themselves individually. We all accept that obesity is related to many other chronic health conditions. It would be a rare person that you would meet that would say they haven't tried to lose weight at some point in their life. In this particular video, I'm going to review a book, Jason Fung's book. I'll hold it up for you so you can see it. Jason Fung is a Canadian nephrologist who is very interested in treating patients with obesity. He also is a big proponent of fasting. Many of his tips that he gives in his book I already use with my patients. I think it's good to have a perspective from another physician. Sometimes this can add weight to recommendations. I've listened to podcasts and educational pieces from Dr. Fung and find him to be very helpful. His practice has been very successful in helping many patients achieve better health. For those that don't want to go through this whole video, I'm going to list off his recommendations at the beginning, and we'll cover these in more depth throughout the video. His recommendations are: reduce consumption of added sugars, don't snack, make breakfast optional, certainly don't use any sugar added drinks, reduce consumption of refined grains, moderate protein consumption, increase natural fat consumption, increase consumption of fiber and vinegar, and intermittent fasting. I wanted to read off some of the conventional answers to what we can do to fight obesity, and you'll have heard many of these. There is a pattern running through them, and I'll discuss that. I'll just read the list. Ways to lose weight: eating 6 times a day, eating high protein, eating more vegetables, eat more omega-3 fatty acids, eat more fiber, eat more vitamins, eat more snacks, eat a low-fat diet, eat breakfast, eat more calcium, eat more whole grains, eat more fish. The pattern running through all these, of course, is eating more. This allows you to consume more. This allows people to sell you more. In his book, Dr. Fung attacks some of the common myths regarding eating. One common myth is skipping breakfast. I was taught this, and many other people were taught that if you skip breakfast, it is common for you to run out of energy during the day, and it also may slow your metabolism down. Other people state that if you don't eat breakfast, you're likely to overeat calories later in the day. The eat more breakfast suggestion also holds true for snacking. In other videos, I've talked about how breakfast was probably partially invented by food producers. Once again, this falls into the consume more category. Snacking is the same. If you look at a grocery store and look at all the available snacks, there's a dizzying array of foods available to you. Some of these recommendations may not be bad. For example, when they say eat more fruits or eat more vegetables, this can be healthier for you as long as you eat these foods in replacement of other foods that are not healthy for you. Jason Fung talks about the population of people that are most affected by obesity. Unfortunately, this is the impoverished population. Unfortunately, high carbohydrate containing processed food is cheap and is accessible by almost anyone. These government subsidies have made for cheaper access to these foods. Of course, corn has been used to make high fructose corn syrup, which has been a dreaded invention of our time. With the increased wheat production and increased processing, we have greatly changed the type of food that we ingest. Consider that processed wheat and refined flours have very little to do with the wheat that our ancestors ate. Dr. Fung indicates that over the past 25 years, newborns have gained an average of 1/2 pound. A baby's weight is determined by the hormonal profile of the mother, has nothing to do with the baby's exercise, for example. Children are being affected by obesity in greater and greater rates. And in fact, we already are doing studies in treatment of obesity in children. Some of these studies are efforts to reduce sugar-containing drinks and high carbohydrate or high dense energy type foods. It seems like obesity is starting from the beginning of our existence at this point. We have known how to treat obesity for hundreds of years. The Physiology of Taste was written in 1825 by Savarin. I'll read a quote from this book. "Of the chief causes of obesity is the floury and starchy substances of which man makes the prime ingredients of his daily nourishment." A little bit later, there was an undertaker by the name of William Banting who was unhappy with his weight. He had tried vigorous exercise such as rowing and was unsuccessful. He talked to his surgeon who told him to avoid starchy foods. He avoided the following: bread, beer, potatoes, sweets, and milk. He then wrote a pamphlet in 1863 titled "Letter on Corpulence Addressed to the Public." In this pamphlet, he believed that weight gain was a result of eating too many fattening carbohydrates. Dr. Benjamin Spock wrote the famous Baby and Child Care in 1946. I'll read a quote from this book. "Rich desserts can be omitted without risk and should be by anyone who is obese and trying to reduce. The amount of plain starchy foods taken is what determines how much weight they gain or lose." I've talked about this in other videos, but in the 1950s, America became obsessed with fat due to what was considered an epidemic of heart disease. At that time, fat and cholesterol were lumped together as likely culprits to cause this disease. In 1977, we had the governmental decree, the US Dietary Guidelines. We now recommended increasing carbohydrate intake to 55 to 60% of calories and to have no more than 30% fat intake. Shortly after this, we developed the food pyramid and its multiple iterations that have come years later. Quite a departure from our predecessors who recommended low carbohydrate diets to treat obesity. We have wondered if obesity is heritable, and this is actually fairly fascinating. We've noted a 70% concordance in parents and their children with obesity. And this even holds true if children are adopted into another family, and later parents and children are compared in obesity rates. On the surface, this might suggest some heritability factor. However, the rate of change of obesity speaks against this, as not enough years have passed to really explain this type of genetic transformation. That leads us to wonder if children are obese due to the hormonal profile that they inherit from their mother. Obesity has often been simplified to the calories in must equal calories out. Dr. Fung challenges this notion in great detail in his book, stating that both of these factors are highly dependent variables. Both of these factors depend on each other. Trying to leverage the calories in, calories out equation with either starvation type diets or exercise has been unsuccessful. I'm not going to review all the studies that he mentioned in his book, but I will highlight a couple of these and make some observations. One of these studies was by Ansel Keys in 1944 and 1945. This was a starvation study that was held in Minnesota. In this study, 36 healthy men had their calorie intake decreased from approximately 3,000 to 1,500 calories per day, and they targeted about a 24% weight loss in these people. I'm going to read some of the symptoms that were noted in the men in the study. They became cold, had decreased basal metabolic rate, developed neurosis, became fixated on food, decreased heart rate, decreased blood pressure, experienced hair loss, and brittle nails. After these participants were allowed to rehab and eat, they regained weight and in fact overshot, and their weight exceeded their baseline weight before the study. Two observations. One is your body tries to compensate with the energy expenditure equation to try to prevent death. The other simple observation is you feel terrible when you are involved in a starvation type diet. In another study in 2008, participants in the study lost 10% of their body weight. When their total energy expenditure was measured, even a year later, it was still less than baseline. There was a Women's Health Initiative dietary study published in 2006. In this study, women had an average starting BMI of 29, which is nearly obese. Women were encouraged to exercise, but were recommended to have a low-fat diet intake during this time. Over the first year, they did lose some weight. Unfortunately, after year 2, they had regained the weight back. Their waist circumference and waist to hip ratios increased, suggesting that the weight changes were not lean muscle. In total, this study went out for about 7 years, and it was found that the max weight loss ended up being about 2.2 pounds. Jason Fung talked about the exercise myths. He feels that exercise probably accounts for 5% of weight loss in most people, with the other 95% being related to addressing hormonal factors with diet and other strategies. You don't commonly hear of stories of people in the 1950s going to the gym for hours at a time trying to lose weight. I don't want to discount the benefit of exercise because it surely does benefit you in many ways, often with sense of well-being and mood and mental health benefits. I've discussed this in other videos. Dr. Fung talks about the total energy expenditure and how this relates to factors that include just the need for body metabolism, not just exercise. Once again, challenging the notion of a simple formula like calories in, calories out, and how it does not work. Our body prompts us to increase caloric intake when we are exerting ourselves more. It is also common to do less exertion if we've been exerting ourselves all day. Dr. Fung then reviewed a couple of what are called overfeeding experiments designed to make people fat and to see what the outcome of these are. In the 1960s, Dr. Ethan Sims first tried this in mice and was unsuccessful trying to overfeed them. He did a follow-up study in Vermont college students who were lean and healthy and had similar results. Could not induce obesity with overfeeding. Dr. Sims was persistent and even tried this in prisoners, and then, as well as overfeeding them massive amounts of food, severely restricted their exercise. Some of the prisoners actually gained up to 25% of their body weight at baseline, but then lost it again when this trial was stopped. It seemed clear that overfeeding did not cause obesity, which is contrary to what most people think, intuitively anyway. This brings up the notion of your body having a thermostat type regulatory function that helps you to maintain a certain set weight. In 1994, scientists discovered leptin. Leptin is a hormone secreted by fat that seemed to be functioning as a regulator of this thermostat. People that had higher levels of fat tissue seemed to have higher levels of leptin. It was then felt that obesity is a consequence of leptin resistance. Insulin was discovered as a regulator of metabolism as well. If you have a high insulin level, then your body wants to store sugar and fat. If you have a low insulin level, your body wants to burn glycogen, which is stored energy in the liver, and also burn fat. Insulin levels can be measured on fasting blood samples and are found to be high in many obese people. Insulin has been shown to cause weight gain in diabetics and non-diabetics. Obese people are noted to have both leptin and insulin resistance. Unfortunately, insulin resistance causes higher insulin levels, which in turn causes insulin resistance, a very vicious cycle. Once you're in this cycle, this is a hard one to break. The longer you're obese, the harder this cycle is to break as well. If you study the physiology of hormones and how long they are active in your body, you will notice that for most hormones, they are secreted in short bursts and then the level significantly decreases. In obesity, insulin levels can remain constantly high. Your body acclimates to this because it's getting a constant level of this hormone. This acclimatization is called developing resistance. So then the insulin is not as effective in doing its job. Dr. Fung reviewed a couple of surveys about feeding. In 1977, most people ate about 3 times a day. By 2003, most people were eating 5 to 6 times a day. This results in increased insulin levels that are persistent and persistent longer throughout the day. Dr. Fung also discusses cortisol. Cortisol is a stress hormone, a hormone that's released in response to stress that stimulates your fight or flight response, sympathetic nervous system activation. The role of cortisol is to make energy available to you immediately. So short-term increases in cortisol will increase your blood sugar. So one might consider cortisol and insulin having opposite effects in a short-term stimulation or a crisis type event. Long-term stress has a different effect. Insulin level remains high and cortisol level remains high. Then you develop insulin resistance, as discussed previously. Sleep deprivation also increases cortisol levels. In studies, one night of missed sleep can result in as much as 100% increase in cortisol levels. And even the next day, cortisol levels can be as high as 45% above baseline. A study that restricted sleep to 4 hours per night in participants resulted in a 40% decrease in insulin sensitivity. Dr. Fung talks about fructose. I have another video fully devoted to fructose, so check that out if you're interested. Fructose is a sneaky one. It has a low glycemic index. Of course, the glycemic index is actually intended to measure glucose, not fructose. Fructose produces only a very mild elevation in insulin. Many people know that fructose is in fruits. It has to be healthy, right? Our cells can't really use fructose very well. Excess fructose is converted to fat in the liver, and you develop fatty liver. In studies of healthy subjects, 6 days of excess fructose result in changes, including insulin resistance. After 8 weeks, these healthy patients were noted to have prediabetes. Dr. Fung discusses diet soda and artificial sweeteners. The short summary is none of these are probably that great for you. Diet soda studies have even shown increased obesity. The premise behind using artificial sweeteners is that you're not using sugar. Unfortunately, some of these artificial sweeteners still stimulate insulin at a fairly high level. Artificial sweeteners might increase cravings for other foods that are not healthy for you. If obesity is driven by insulin rather than calories, then artificial sweeteners are not a great option. Dr. Fung discusses the topic of fiber. We have a process called refining where we separate elements of certain foods. And when you refine carbohydrates, for example, you are purifying and concentrating the carbohydrate. This will allow these carbohydrates to be absorbed and digested much more quickly and increasing their glycemic index rating. In general, refining carbohydrates encourages overconsumption. Dr. Fung gives the example of comparing juicing 5 oranges to make a glass of orange juice versus eating 5 oranges. It is much easier to drink the glass of juice than to eat 5 oranges with all the pulp. Wheat has also changed and has been highly refined and processed and is much different than what our ancestors ate. Of course, wheat is linked to celiac disease, which is skyrocketing. Celiac disease causes inflammation of multiple body systems and chronic illness. Fiber does have some good properties. For one, fiber requires chewing, which can slow down the eating process. Fiber also can swell in your stomach and form a gel when contacted with water. This can cause your stomach to feel more full and can prevent you from taking in excessive amounts of food. With fiber, you have increased stool bulk, which can increase calorie excretion also. I'm going to read a list of some of the sources of fiber that Dr. Fung recommends. Fruits, berries, vegetables, whole grains, flax seeds, chia seeds, beans, popcorn, nuts, oatmeal, and pumpkin seeds. Dr. Fung also discussed vinegar as a protective factor. Short-term studies indicate that vinegar can decrease insulin resistance and decrease blood glucose levels. One of these studies indicated that when you add vinegar to sushi rice, you can decrease glycemic index by up to 40%. Many people take apple cider vinegar and dilute it in water. Protein is another hot topic that Dr. Fung discusses. The summary is that most food stimulates release of insulin when eaten. He talks about a couple of the incretin hormones, GLP-1 and GIP. Fats, amino acids, glucose, and artificial sweeteners all trigger these incretin hormones. Pure fats such as olive oil do not stimulate this very much at all. These incretin hormones also result in delayed gastric emptying, which can slow down absorption and can make you feel full for longer. Dr. Fung's conclusion is that calorie is probably not the correct unit to be used in measurement. With regards to obesity, Dr. Fung feels that insulin is the most important unit of measure. To summarize so far then, Some inputs include the incretin effect from certain foods that you eat, fattening carbohydrates, and increased cortisol levels can all contribute to obesity as they all stimulate insulin. Fructose causes insulin resistance. Insulin resistance causes higher insulin levels. And then we have protective factors such as fiber and vinegar. Dr. Fung then talks about fats. I'll read off a couple of studies that he referenced. The Nurses' Health Study, 80,000 nurses over a time period of 14 years, total fat was not linked to risk of coronary disease. In a 2014 study, the Swedish Malmo Diet and Cancer Study, same conclusion. The Japan Collaborative Cohort Study for Evaluation of Cancer, a 14-year study with 58,000 patients, and also a 10-year health professionals follow-up study of 43,000 men, both found protective effects on stroke with increased fat intake. The National Cholesterol Education Program also admitted that the percentage of total fat in the diet was independent of caloric intake has not been documented to be related to body weight. It seems that high dietary fat is not truly linked to obesity and other health problems, according to studies. Dr. Fung states that weight loss is a two-phase process. One is the short-term weight loss, the second is the long-term weight loss. Once you are able to get below the hypothalamic set point on the thermostat to control your weight, then you have to deal with a long-term persistent prevention of weight gain. His recommendations are to reduce sugar, don't snack, make breakfast optional, do not add sugar to any drinks, reduce consumption of refined grains, moderate protein consumption, increase natural fat consumption, consider the use of fiber and vinegar, and also fast. Dr. Fung is a big proponent of fasting. Intermittent fasting prevents this process of acclimatization that we discussed earlier. Fasting decreases insulin level, increases growth hormone level, and increases adrenaline level. This also increases resting energy expenditure. Dr. Fung did give some advice and gave some alternate names for sugars that you might see on labels of products, and I'm going to read from this list as this can be helpful. Sucrose, fructose, glucose, maltose, dextrose, molasses, hydrolyzed starch, honey, invert sugar, cane sugar, high fructose corn syrup, brown sugar, corn sweetener, rice, corn, cane, maple, malt, golden, palm syrup, agave nectar. These are all possible substitutes for sugars. If you want to think about what to do for dessert, he suggests nuts, berries, and even cheese. If you adopt his principles, your chance of losing weight is very high. This could truly save your life, as obesity has been linked to many serious health problems. If you are my patient, I hope you found this information useful. If you are not my patient, I would like you to see your own doctor to discuss diagnosis and treatment. This is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life.